Hello, this is Dr. Lewerenz at Longevity Health Institute. So today, actually, I had this thought about speaking with you about, if you will, medical mysteries. So I've had a few crazy weeks traveling to a few conferences, one in Nashville, one in Las Vegas, basically the RAD Festival, which is a longevity advanced scientific conference, and one that was presented by a supplement company that was scientific literature, advanced scientific literature that's kind of coming out here. And then interestingly, this last week or two, I've had some difficult cases here where kind of, if you will, and three are on my mind, and I'll tell you about all three of these, but they literally presented themselves as, if you will, they're a medical mystery. So I thought I would share these with you, and this excites me because I will tell you what, one of my passions is figuring you out and helping you and putting you on the right functional, physiologic, medical path to not just be well, but also to be optimized and to living to the fullest you can. And one of these cases, for instance, is somebody that really struggled with pain and fatigue and stuff. And so I thought if I share these with you, yes, they're interesting, but you could share with others, family and loved ones, and maybe something could be done for somebody out there that receives this message. So these are my medical mysteries, and I'm going to start simple. One was actually just the other day, and this gentleman came to me, middle-aged, late 40s, early 50s, if I recall, and he had been on hormone replacement, testosterone replacement, and tried many methods. And this is an easy case, but I just want to mention to you, in our functional medical model, we always look at hormones as balance. It's not all one hormone will give you everything. It's not all growth hormone or all testosterone, or in a woman all estrogen or all thyroid. I get that people will say, oh, I'm tired, I gain weight, my thyroid must be off. It's not always true. Hormones about balance, about being optimal, about being balanced, and they affect each other. Every cell in your body's got a hormone receptor, so these are delicate and you have to look at them all. So this gentleman actually had been on testosterone replacement for about 3 years and had been to many doctors, done shots, creams, pellets, back to shots, and basically had felt this effect of like, well, I'm better, I have better vigor and libido and energy, but I didn't lose weight. I still have these crashing episodes. I don't get the results in the gym I want. I can't lose weight. And if anything, I feel like I'm going a little bit backwards. Currently, he had come in on and been on testosterone pellets. We do testosterone pellet hormone replacement very frequently because you get the best physiologic release of that hormone that's steady for 3-4 months on a regular daily basis, and anything that follows and mimics physiology is going to work the best for you, the patient. So keep that in mind always. So this gentleman, again, was, if you will, the roller coaster effect, was not improving. So long story short is with him, and he wasn't that hard to figure out, I told you, is that we needed to look at his estrogens, because testosterone is a big converter to estrogen through the liver. No one had really efficiently done that. And pellets were probably his best option, but in his story about fatigue and kind of these waxing and waning episodes after he had a testosterone pellet that again should last about 3-4 months, he was getting like a drop-off effect of libido, and he got moody and you get really tired and etc. And long story short here is that no one considered his adrenal hormones. So that's why he would switch from these practitioners in therapeutics of, well, let's try testosterone cream. Well, let's try testosterone shots. Well, let's try testosterone pellets. Oh, maybe you need more and more and more. And essentially he's chasing his tail with this hormonal cascade. So he was missed, we caught it here, is that he has adrenal issues, adrenal fatigue. Common symptoms are when you exercise, yeah, you can get through it and it feels good, but you don't recover as well. You often can get hurt easier. He was doing this. He wasn't losing his fat and actually getting the result he expected from the effort he put in. And a common scenario with adrenal issues is when they work out, they release more cortisol. But you have to remember the adrenal reserve, the gas tank, if you will, is low. So they feel better with exercise, but within an hour or two, or maybe at most 3, there's a significant crash. Because what goes up always has to come down. So if you're somebody out there that exercises, that really pushes it in the gym or in their exercise routine, and after exercise you feel very just beat up, you can't recover, you feel real sluggish, you feel like you could have a nap, you kind of crash within a few hours after exercise, this is a classic example of adrenal issues and adrenal fatigue, and it should be evaluated. I like to evaluate through saliva. You can evaluate adrenals through urine. Blood is not so effective, but this is a classic story. We can give him adrenal support, adrenal herbs, nutrients that support the adrenal gland, back down on stress effects in his body, make sure he's sleeping and regenerating well, and he'll do wonderful. He'll do fine. We kept him on testosterone pellets. We're going to manage his estrogen because that's going to give him the best of both worlds. But again, you're not going to feel the difference in a pellet, or you're going to think it's a testosterone issue, yet he's got this adrenal fatigue issue. And admittedly, by the way, in his story, as we tease through and unravel the onion, he's had about 2-3 years of family stress, work stress, juggling children, profession. He had a little bit of an illness for about a few months with a dental infection. And then, of course, what does he do? Men, us blockheads, train hard. Go to the gym, let's hit it hard, work harder, I'll get a result eventually. And he was basically going backwards because he was taxing an already taxed reserve on his adrenal gland. So something easily really solved there. So this is a lot tougher, medical mystery and solution here. So we do see here a lot of patients that have autoimmune issues and immune imbalances. And this patient had been to many physicians and professionals, alternative care providers, chiropractors, naturopaths, functional doctors even, and all did very well. I mean, they all had good intention, all got him on her on a significant path. But here's what her issues were. She's around 52 years old in menopause. She had chronic pain and chronic inflammation, and muscle aches and debilitating fatigue, and mind you, some other simple things that were pretty obvious that had gotten somewhat better but not completely solved, digestive issues. But basically over the last 3 to 5 years, she had been struggling with significant fatigue, so bad that she'd have to leave work, or so bad that she would be crying in muscle and inflammatory pain to her family or her husband. And mind you, this is a 50-year-old woman, and could not get through that, but then also have times for a week or two or a month where she would be doing fine, maybe a little tired, but not having this kind of debilitating, not able to function kind of symptoms. So she has seen many physicians and again other practitioners, and somewhat had gotten better, but she still would continue to get these episodes and of these reoccurrences of this debilitating fatigue and pain, and literally she'd said she'd have to collapse almost on the couch or on a chair or on the floor, and sometimes sleep there or lay there for literally 12 hours, 15 hours, she said. So she had a big extensive workup, and I looked at that and evaluated it, and I think a lot of it gave us some good things and ruled out a lot of bad things. But there was something in her story that actually even though she was originally evaluated for autoimmune issues, she did not have a positive ANA, which is a classic marker for screening for any autoimmunity. And she did not have a classic lab that indicated things that would be typical for muscle or inflammatory type of issues like rheumatoid arthritis and that, because those were ruled out in labs. And so she was kind of, I hate to say, I don't mean blown off, because these physicians and practitioners were doing their best and looked at the details and ruled out a lot of bad stuff, but she still had these episodes and still lived in severe pain. So, and she was labeled with fibromyalgia. And fibromyalgia is a general, throw-out term for, you have a nerve sensitivity, you live in pain and fatigue and stuff, and the pain moves around, and it's a legitimate diagnosis, but we really don't know why. And you've probably heard me in videos say this before. A lot of fibromyalgia patients are tied and latent in the functional issue of hormonal dysfunction or hormonal imbalance. The other thing that's super key is that there's something typically immune related to fibromyalgia and inflammation. So here in our model, what we did is we teased through things that weren't looked at, a little bit deeper into gut health using live blood, breath testing, stool analysis. We looked at all of her hormones, okay, evaluated those. She was postmenopausal. I do believe this plays a big role into inflammation and energy and fatigue, okay? And we got her sex hormones balanced, her testosterone, her adrenals, her estrogen, progesterone. She got significantly better, 30-40% better. Sleeping better, gut better, diet better, lost a little weight, okay? But it took us about 6 months to a year to get there. And again, though, she'd still have these episodes, not as frequent, but of these debilitating pain and fatigue and stuff. So we unraveled a little bit closer, and we looked at actually markers on here that are immune markers, CD4 helper cell markers, CD4, CD8 ratios, immunoglobulin numbers. And not that I expected this, by the way, to lead me to a definitive diagnosis, but what it did lead me to is to understand, does she have an underlying autoimmunity or what we suspect is an autoimmunity? And she did. And then what I did is I looked at some muscle inflammatory markers and some antibodies that are specific for that. And those were positive also. And so we recently just sent her to U of M to get a muscle biopsy to confirm, and I do believe that it'll be positive for an autoimmune muscle inflammatory condition like polymyalgia rheumatica, or potentially another autoimmune condition that sometimes autoimmune lab tests take a while to express themselves. But I caught this, and here we caught this by looking a little deeper into what is really her immune numbers doing. Not any lab marker that definitively defines a disease, but really where is her immune balance. And so this helped us lead us down that path. Now, here's the thing is, she'll get a full diagnosis. But here's the thing is what we did is, those people are very, very, very inflammatory sensitive. And so yes, we have tools that we can treat autoimmunity and balance their immune system. But in the short term, we had to put her on short-term steroids that essentially mimic cortisol, mimic an adrenal response. Because any stressor, and I mean minimal stressor, okay, her adrenals really tank and she gets this big inflammatory reaction, pain, fibromyalgia type stuff, fatigue, debilitating, okay? Now there's probably more there and we'll unravel even more, okay? But she's already out of pain, again, lost weight, energy's better, functioning much, much better, okay? I do believe that we're gonna end up with a firm autoimmune diagnosis, and then we're gonna have to still dig deeper into why she developed an autoimmune diagnosis. Could be heavy metals, could be poor methylation and detox, but it always starts at the gut and inflammation and immunity and your hormones. So hormones have to be fully appreciated. So that's case number 2. Number 3, hopefully I'm not boring you, but number 3 is actually interesting too, because this is a case or a scenario, probably it's extreme to call it a medical mystery, but it's a case or a scenario that often we see, and it's not really, if you will, appreciated, okay? So when somebody develops any type of calcification, okay, in the body, calcified deposits. So this person had come to us with a complaint of calcium deposits, and they asked this, and a lot of times, this is a question that we won't get asked, it won't come to fruition, because really it's not a quote-unquote disease. But they had noticed that in multiple years, 10, 15 years of reports, that they're laying down calcium in areas. They're laying down calcium, they have calcified dense breasts, they've had ultrasounds that have calcifications in them. They have calcification deposits that have shown up in fat on CAT scans. They've had calcified renal stones that 10 years ago, until they did a really good diet and got less inflamed, they had some kidney stones. They have calcifications that are laying down in their bone without really any big major trauma and stuff, okay? At the same time, as they get older, they're developing a little bit of osteoporosis, okay? So they're losing bone and they're developing, this kind of age-related bone osteoporotic loss. So again, this isn't that tricky, but it's something I want to make sure that is really appreciated, and this is a big one to share. If you've ever been told that you're calcifying things, You have calcifications in your arteries, calcifications in your kidneys, or kidney stones that are calcified, or calcified deposits in your breasts. Anything like that, that is a sign, okay, that one, you got a hormonal dysfunction. Very likely a man in andropause or a female in menopause. Those are the channels that keep calcium in bone, okay? And they keep maintaining bone. Once you lose those, the channels open up or switch a little bit, so you get essentially more calcium loss going into the system, and then they want to lay down elsewhere, okay? And the worst thing you want to do is harden things in life. Aging, in fact, structurally dysfunction is hardening. Hardening of the arteries, hardening of joints, stiffness. You lay down deposits that are hardening. Essentially, they're ischemic blood supply or calcium deposits in your brain for dementia. So these are very, 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 very valid things that are happening all over and everybody that we know, but you want to slow these down. And you can do that with hormonal therapies, but you have to appreciate what the hormone's doing. This individual did not have an evaluation for something called their parathyroid hormone. So your parathyroid hormone has to be evaluated when we're seeing either high calcium in your blood, or you're doing a lot of this process where you're being caught that you're laying down calcium elsewhere, whether it's your arteries, your breasts, your fat, stones, etc. Okay, so you want calcium to some degree in your blood, but you want most of it to be maintained, and I'm making this sound simple, but in the bone, keeping the bone strong. Okay, so you have to evaluate the parathyroid hormone. Like other glands in the body, though, which is interesting, the parathyroid hormone, which is right around your thyroid gland here in your neck, actually can get overactive as you age. So hyperparathyroidism causes calcium loss in the bone and more deposits in the body. Okay, so it kind of switches the switch, so you get the opposite of what you might think or want from a health and calcium standpoint. And this is where I preach: you don't need a lot of calcium supplementation. You need minimal amounts of calcium in your diet, and check your levels, of course. Do it always personalized. But hormonal balance, that's why the youth don't have these issues, maintains calcium in the body where it should be. So keep that in mind, okay? This person was easy treated, and we got their calcium levels down, and we use hormonal replacements, got all their hormones balanced, including the parathyroid hormone, and the calcium then is being maintained in the bone. Probably one of the worst things you can see is calcium being laid down in the arteries and the coronaries, on what we call vegetations, on valves of the heart, etc. We have medicines and drugs that treat this, but one of the most natural, easy things you can do is actually use vitamin K, menaquinone or MK7. It's a certain type of vitamin K that keeps the calcium out of your arteries and in your bone. So just a side note. So this video, yes, a little long, hopefully not too winded. I do want you to share this with others, because these medical mysteries, when you think functionally, and I love this part because it's like being kind of like a, if you will, a Sherlock Holmes kind of investigator. You got to think a little deeper and think how the physiology of the body works. It's most important to always rule out the bad stuff and then look at physiology of how someone functionally works. But this is where then we can solve these wonderful things that we can discover in science and in physiology that can help you be well and not just survive, but thrive. And you always hear me say that. So medical mysteries are typically only a mystery for a short term if you think physiologically and functionally, and that's what we love to do here. So this is Longevity Health Institute. This is what we do. This is what we're passionate about. We'll always be here waiting for you and your loved ones, okay? And I'm Dr. Lewerenz. Be well.